Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. CeCe, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Annah Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health.
Welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. CeCe, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama of 4 probably. We have a dog in the house, and our equipment almost just went.
We got it. I'm Anna Kate. I'm Anna Kate, your medical mystery overachiever. It's been one of those days. We got a lot done. So
we did, and we are back with our mini-sodes. And our last one, we were talking all about kind of what yearly wellness looks like in terms of labs as well as supplementation. And we want to piggyback off of that and dive deeper into labs specifically and reference ranges and just what is the difference between looking normal and being optimal.
Right. And what's your normal and going through over all of those basics. So sorry, she got left alone. Okay, come settle. We're almost done, belly girl. Come here. Yeah, let's talk about the binder. Let's show them.
Okay. So okay.
We're good.
I can't. My brain. I can't focus.
Okay,
girlfriend, you're giving my brain anxiety.
Welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. CeCe, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama, and our hosts, plural.
I'm Anna Kate, your medical mystery overachiever and discovery liaison, and we are joined by Miss Ellie Belly today. Yes. She's going to join us right here on the couch. And
she's very lonely, and so we're going to make her feel comfy and at home, and she's going to stay and be our special guest, and maybe take part in our conversation. Who knows? We are piggybacking off of our last mini-sode, which had to do with all things wellness, what labs to look at yearly, and really comprehensive labs, and knowing the importance of knowing your values as well as supplements. And so we want to dive deeper into reference ranges specifically and what those mean, and facts that not everybody fits into the box, and not everybody is optimal, even though they look normal on paper. So Anna Kate has brought out her handy dandy notebook, in which we will talk about
the binder.
Binder. Sorry, the binder, not the notebook. It is much more than a notebook. It is a binder. But we'll kind of go through some pertinent lab reference ranges that I think are very important for you to know. Now, medical disclaimer, it is never your job as the patient to go through your labs and to decipher what they mean on your own. You should have a really good practitioner who can help you do that. This is just my advice if you get a practitioner that says, hey, you look normal, everything's a normal reference range, and you're symptomatic, these could be reasons why. These are things that I look at where my brain is fine-tuned to look inside of labs that look normal outwardly and find holes.
Right.
And find like little clues as to what might be going on in that patient's immune system or body so that we can get an answer. So let's start with the basics. Let's go to a CBC. CBCs look at white blood cells, red blood cells. My main focus here will be on white blood cells because the breakdowns and the ratios really matter.
Right.
And so our overall white blood cell count, you can look in the normal range. But if I have a patient who has a white blood cell count of, let's say, 9.8, that's in the normal reference range. But I'm like, ooh, and you're trending a little bit higher on the higher end of norm. If you are somebody who is overall well with no issues, number one is that could be your norm, right?
Yeah.
But if you are someone with chronic symptoms that has been, lasting for 10, 15 years and you chronically trend on the higher end of white blood cells, that can be a little flag for me to be like, okay, what is going on? That's a little too activated of a white blood cell.
Right.
Or in Anna Kate's department, it could be chronically low. And okay, is that one your baseline if you're overall healthy asymptomatic? Or is that your immune system telling us some information where it might not be as low as Anna Kate's is, where it's actually flagged as low? It could be a 3.4, where it's right on the cusp. And then we look at the actual breakdowns of those white blood cells. So the lymphocytes, the neutrophils, the eosinophils, the monocytes, the basophils. And each one of those has a percentage of which it makes up 100% of white blood cells. Mm-hmm. A perfect, picture perfect. So again, picture perfect is usually non-existent, but take it with a grain of salt. Picture perfect is neutrophils at 60%, lymphocytes at 30%. If I'm dealing with someone with chronic symptoms, if that ratio is off, it tells me a lot. If neutrophils are elevated, let's say at 70%, and lymphocytes are low, let's say at 20%, that tends to tell me that something chronic bacterial is going on. If they're equal, let's say both of them are around 42, 45%, that can tell me something more viral, chronic is going on. If eosinophils are up at, eosinophils should be 1 to 3%. If they are up at 11%, 12%, that tells me that that person is super histaminic and we need to figure out why. So I say all this to say is that when you get a lab report back, let's say that your lymphocyte percentage is high, 75, 80%. It doesn't flag. There's no reference range given on LabCorp request for those percentages. So you as a patient can look at that and be like, oh, it's normal. It's great.
Yeah.
Or another doctor can look at that and be like, oh, it's normal. It's great.
It's within range. That.
Right. Yeah. So here I'm going to pull on Anna Kate a little bit because keeping a trend of that is really important. And knowing for someone who is overall well, knowing where your percentages lie could help somebody in the future identify if you're having a chronic issue or if you are just someone who doesn't fit in this perfect ratio box and this is your body and this is what your body is telling us. So talk to me about your binder.
So my spreadsheet.
Your spreadsheet.
So visual aids, and you can't see this because there's a bunch of tiny numbers, but I have a back and forth of all of the labs that go back to 2014, as far as back as this sheet goes. So I've been tracking, I just get my normal labs and I just go in and I put them on here and then I just list them in the same order. So when I get the same lab again, whenever that is, I can just go back and put it on the year to move forward. So that allows me to walk into her office and say, as a new patient, and say, hey, here's my labs for the last 6 years. And she can look at the trend and see, and you can't see it, but on my white blood cell count, there's a lot of red numbers here. They're all red though. And so that's my trend, that when we get my blood count up to 3.3, that we're moving in a really good direction. Right. But for someone else, that's not appropriate. So I keep this. It's something that I do every now and then. And whatever tests I do, I just put them on my master spreadsheet. So a lot of it's empty. That's right. That is right, belly girl. It's empty, but then it's like, hey, I didn't have this panel, this hormone panel. I did it once 3 years ago. So I don't need it every time. But next time I get it, I will have something to compare it to 5 years ago or whenever it was. So this is a really key piece of information just to have for you and for your family.
Understanding your body and how your body operates. And if you do or are having more chronic issues, to see, yes, okay, I'm trending in the right direction. It might still be a little bit low or it might not be perfect, but I am trending in the right direction. Another speaking of hormones, well, I won't skip there. I'm going to go in my little OCD order. But another one, like an easy one, is vitamin D. Like vitamin D, the reference range is 30 to 100 on LabCorp. So if you're right at a 30.0, you are, quote, normal. But I would put an optimal range between 60 and 75, depending on the person, because vitamin D is so crucial to synthesizing our hormones, to our neurotransmitter support, our mood support, our immune support, our bone support, that I don't want you just skating by. I want that to be a great optimal number, whereas somebody else would look at a 30.0 and be like, great, you made it. Like you made the cutoff. You're good. Hormones, then speaking of, is really important to identify the correct route in testing hormones, especially for females. Males are very easy where they turn over their testosterone every 24 hours very quickly. So looking at hormones for men on blood work is totally fine most of the time. For women, it makes no sense because our hormones cycle every 30 days. Yeah. And so there's an appropriate time to look at, I would say sometimes they're better than others on paper to look at, or in terms of blood, like the week before your period. But otherwise, it should be over that 30 days. What's your estrogen doing over those 30 days? What's your progesterone, your LH, your FSH doing over those 30 days? And then things like testosterone or DHEA or dihydrotestosterone can be tested in the blood more efficiently, in my opinion. Yeah. So having a practitioner that knows the correct utilization of labs and not just looking at your estrogen and progesterone once on blood work and saying, okay, it looks wonderful. Okay, but that looks wonderful at 4:59 on a Monday afternoon. What about the rest of the month?
Right. And what phase are you in? Are you in your luteal phase? Are you ovulating? Are you doing all the things? Oh, am I touching the mic? Sorry. Excuse us, listeners.
And then the other one that kind of follows suit with that is cortisol, because cortisol fluctuates over 24 hours. So most of the time, I mean, I might start with a cortisol in the blood, but most of the time, if I'm feeling, if the patient is presenting as if they might have an issue with cortisol, then don't go to blood. Go to a 24-hour, either minimal 24-hour urine test, although I prefer a 24-hour saliva test. And this is an important differentiation because let's say a practitioner orders a 24-hour urine test through LabCorp. You pee in a jug for 24 hours, and then they take the average of that over your 24 hours. So
that's not how your cortisol cycle happens.
Okay. So cortisol changes over 24 hours. You wake up, it's about 60% of its max. Within an hour of waking up, it peaks, and then it falls down over the course of the afternoon and falls down, 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 and down, and then plateaus at night. And that's when your melatonin kicks on, and that's your sleep hormone. So cortisol is our wake hormone. So like that 24-hour urine cortisol test, all it's doing is taking all of that cortisol within 24 hours and averaging it and saying if your average is good. You can have a good average number and low lows and high highs,
right?
But then your average looks great in the day.
But that doesn't give us an answer for what's actually happening with our cortisol.
Exactly. And the same thing with on blood work. It's okay, what time were you in the practitioner's office? You were there at 2:30. Great. You have a wonderful 2:30 p.m. cortisol, but what's it doing in the morning? What's it doing at night? And so if there is any question about your cortisol or your adrenal function, then I'm looking at that over 24 hours in terms of saliva, because now I can take multiple samples throughout the day and it actually plots. Okay, here's your first morning cortisol. Here is your midday cortisol. Here's your late afternoon cortisol. Here's your right before bed cortisol. And I can see, are you spiking appropriately? Are you totally flatlined? Are you spiking inappropriately, maybe right before bed?
Right.
So there's just proper ways to look at certain hormones that you could really, really miss issues if you're only looking at as a blimp in time on blood work. And hormones and cortisol are two really big ones for that. Speaking of then testosterone also, I think this is important to note, is that something like testosterone, the reference ranges change. And reference ranges are based on the average American. So, for example, testosterone for men, the reference range, I think it was about 2 years ago, the lower limit was 394 and the upper limit was like 1160. And now, I'm not boring her. She just gets like yawny when there's these type of lights. It's part of her Swiss cheese brain. Or she's putting her dog to bed and slowly fading on us.
Yeah, no, I'm not tired. It's just the lights that make me yawn.
So it was like 394 to 1160 or something was the reference range for testosterone a couple years ago. And now, if you look at testosterone reference ranges, the lower limit is 260 and the upper limit is 934 or something. So they shifted the normal reference range for men's testosterone down 200 points to make more men appear normal, when in reality, men are just, it's historically men have the lowest testosterone ever.
Yeah.
And fertility rates are down more than ever. Not to say that's the only component to it, but
not
that's
the Brooks household. It's not.
No, we're just making machines over babies. There. But all that to say is that change in reference range is not because it's optimal for mankind and for our male species. That reference range is shifting because the labs are just like, oh, well, more Americans have lower testosterone, so we're just going to shift this value down. And people don't realize that America is the most chronically ill country in the world. And so our reference ranges are a reflection of that. It's not a reflection of an optimal human.
Right.
So bear that in mind. If you're a man and your testosterone is 295, wonderful, you made it. You're normal. 2 years ago, you would have been deficient and flagged on LabCorp. In my opinion, either way, that's super low. Most men feel best with that at least 600 and above. But know that about reference ranges, that they change. Thyroid's another one that it happens to. There is, like, probably 5 years ago, the lower limit of a T3 was 2.5. Now it's 2.0 to 4.4. Why? Because most Americans have some sort of thyroid issue. And so it's just the quote norm for us to have lower thyroid hormone. That does not mean it's optimal. In optimal T3, I tell my patients this all the time. So T3, in terms of our thyroid, we have two thyroid hormones, T4 and T3. T4 converts into T3. T3 is what our body can utilize as readily available energy. So the T4 number is important, but it's not the only number to focus on.
Right.
And in conventional medicine, it is the only number focused on. Why? Because the answer is Synthroid, and Synthroid is a synthetic T4. So they don't care about your conversion to T3. Whereas in kind of the functional medicine world, we use compounded thyroid medication that has T3 and T4. So it's very, very rare in conventional medicine that T3 is even tested. But reference range 2 to 4.4, if you're at a 2.2, I'm sorry, a couple years ago, you would have been flagged as very, very deficient. But now all of a sudden, magically, that's normal.
Yeah.
No, it's not. Above 3.2 is like awesome. Thyroid is kicking. I'm getting all this great energy from that T3 value. And anything under can produce subclinical symptoms or subclinical hypothyroidism in terms of symptoms. So we can slow down. Hair, skin, and nails can slow down. We can gain weight. We can be more foggy. Our mood can become, a little bit lower. So knowing that those reference ranges are very faulty, and looking at your labs and understanding, okay, these look good on paper. Nothing's flagged. Nothing's red. Nothing is marked with an L or an H. Does not mean that those labs are normal. It does not mean it. And just having someone who can nitpick your labs to say, okay, hey, you're a little bit low here. Let's go figure out why, can make all the difference.
It doesn't mean that it may be normal or may be common, but it isn't optimal.
Yeah.
So we want to make sure that we're going off of your numbers because, just going back to my white cell blood count, that if you flag this at just a regular doctor, then they're going to think that my white blood count is low and then there's something like super wrong with me, but I just trend I just trend low. Even now I'm on the lower side of what was mine today. I got mine done today. So I don't know, 4. Anyway, doesn't matter. But whenever I get new lab work, it goes in the binder, usually at the doctor's office, and I keep all of the things in order because of it's just how it helps with my brain. So I do highly suggest that you get one of these for the year, at least for your family. So if you're taking kids to their well visits or to the dentist or anything, just keeping all your medical files in order based on the kid and based on the timeline, so that when the time comes to do anything with taxes or putting things in order, that you've got it all ready to go and you're not having to go and look for all the things all over the house.
And the other thing is, like, little medical disclaimer at the beginning said it's not up to you as the patient to decipher your labs. However, unfortunately, a lot of times patients will not get answers from providers, and so they take things into their own hands. And this can be a really good way for then if you have something you need to uncover in terms of your health, this can be a really good way to catch that, or for you to even look at these labs and be like, oh, okay, I've been trending like this, which is my norm, but holy moly, then it changed here. Mm-hmm. And now, that you don't need a medical degree to watch those numbers change, and then to help and go find somebody who can help you navigate what it actually means. But you can actually be the one to catch things that way and be more preventative in your health. Not just, I think it's worth it for just understanding your body. And like we said on the last minisode, I'll do some of these very normal baseline labs that I consider very basic. And patients are like, wow, I never knew this about my body. Like, this is so cool. And I'm like, holy moly, how have you gotten to be, 40 years old and you've never seen some of these things on paper about how you operate, how you work. So I think that is very important to know that about yourself, especially if you have chronic things going on, to understand that labs can look great to one practitioner, and then you put them in front of another practitioner, and there are all sorts of red flags everywhere that aren't marked, but I'm going to tell you what those flags are, and they can help us decipher and lead us in different pathways of, okay, what's actually going on here.
Yeah. And it's beautiful to see the trend, and it's beautiful to see her brain work as she's looking at the patterns that I've laid out over the last 10 years. And she can say, oh, what happened here? What happened at this time? Did a stressful event happen? We know what happened in 2020, and you can see my numbers spike during that because it was a stressful time, and just all the changes of what happens. But if I didn't have that information to give her, then she's starting from scratch and then trying to figure out from there. And we don't technically know what my pattern is until we document it and create it. So
exactly
on the patient side, I think it's a great idea just to track your stuff, even if you only do it once every couple of years, because you're healthy, you're trending healthy all the time, which is great. But hey, we had a cold here. It was in September. Kids went back to school. We just could not kick the flu out of the house. But all of just those little things of just making it so that when you do go see a functional medicine practitioner or you do a whole family well care, that, hey, these are just what's happening in our family. And it gives her a great picture of, hey, this is what we can do. I'm not really concerned about this. It just gives her more information, and the more information she has, the better job she can do.
Absolutely. So hopefully that's helpful. I think the biggest takeaways are, one, knowing yourself, knowing your body, not waiting until there's a problem to just understand what's happening in your body. 2, understanding that just because things look normal on labs does not mean that they are. Those reference ranges are BS most of the time. And there's an optimal reference range within that actual reference range that's given. So hopefully this was helpful. We are going to go comfort a very lonely dog. Her siblings were taken from her to go have fun without her. And so we are going to go love on her a little bit. But stay tuned. We have lots more minisodes headed your way over the next, 6 weeks or so. So stay tuned for all those. And until then, let's discover together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, If you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together.
The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The host, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.